Yeah, welcome, Steve.
Thank you, Chris. Nice to be here. It seems like some months since I was last here. Time just flies by.
In Dubai, it flies very, very quick, huh?
Yeah.
Don't imagine it when we're back in Germany or UK.
Yeah.
It's like a slow pace.
It's been that long since I've been in the UK. This is my home now, Chris.
So, how many years now?
It's close to 20. Let's call it 19. Prefer to keep it shorter. Yeah.
20 years. Oh, you probably saw just sand when you look out now, yeah?
Most of that.
The eye level don't
people
exist.
can see, but yeah, a lot of that wasn't here. And this is the old part.
Yeah.
So, yeah. But it's nice. Always something happening.
100%.
Yeah.
So today's topic's health insurance, huh? You're the health insurance expert in the UAE. Number one for the UK.
I still learn.
Relocating.
I still learn every day, Chris. So I'm not arrogant in that way. It's a moving feast.
Yeah. Well, you sense since like now 20 years there's so many UK families moving here, more and more.
Definitely. I think without getting political, but we've got to be frank and open, I think the political situation, particularly in Europe, is creating a lot of people to move to what is a nice place to live, safe environment in Dubai and the UAE. Yeah, I think there's certainly the anecdotal evidence I have is lots are coming here. I think it's something like 1 millionaire every 45 minutes is leaving the UK, which, just the way it is.
It's amazing, yeah. But of course, they're not always coming here, but around the globe, aren't they? But still, it's a number, and you think about it like it's just sounds not much, but over a time.
Well, I'm connected to the British Social Club, which is a new club that's really, as the name suggests, it's to do with the social aspect, but to try and get the infrastructure of Britain's coming here. And they are getting, a lot of contact. They're just in the process of getting the actual website put up. And they see there's a need to have an infrastructure for the social side, but also to help them like business set up. Really get contacted first. Would they refer to companies like yourself? Because people need help. It's easy to say, I fancy moving to the UAE, but there's quite a big difference in many areas to get organised and be prepared. So, there's a lot of people here, and I know yourself speaking German as well, Egypt. They're coming from all over Europe and other parts of the world as well, because it's a safe environment, and that's what, whether you're married with kids, single, safety is becoming in the world more important
100%
than as a part of the decision process.
Yeah, 100%. And just going back to the insurance, what's like the difference of the health insurance NHS in the UK and compared to a Dubai health insurance?
I mean, the NHS is, as the name suggests, a national health service, and it's not an insurance-based model. It's funded by national insurance and tax, and it's a vicious feast in the sense that it's always regarded as underfunded, not enough doctors, not enough dentists, people can't get access. And in the recent years, it seems to be even creaking at the seams even more. I think the benefit with that is that the doctors are all there to try and arguably follow NICE guidelines, which is the National Institute of Clinical Excellence, and what they see in front of them is what they treat. So there's a more holistic approach of, right, this is what we see, this is what we should do. Here, without being cynical, is a private model predominantly. There are government hospitals, that's mainly for nationals. It wasn't the case 20 years ago. There was a health card where people could use that, but it's all been transferred to an insurance model. So there's a mandatory insurance model here in the UAE where people have to have health insurance. There's a minimum base level that you have to tick, and certain levels of cover have to be provided whether you want it or not. So I'm asked by females sometimes, why do I need maternity? I'm not having any kids. It's just mandatory. So there's certain areas that you have to cover, and then there's a huge difference in what you can do in terms of increasing that cover and consequently cost.
You think the coverage or the system is very good compared to the NHS?
Good question, because I don't think there's a perfect model. I really don't. I mean, both models creak at the seams sometimes. The insurance model is, you've got to remember, the insurance company is trying to make money out of you. The NHS,
it's a business, isn't it?
Yeah, it's a different model. There's definite, to most individuals, they'll perceive private medical insurance as possibly better in the sense that, it's there, I can get to see doctors, dentists much more quickly than the National Health Service model if we take the UK and around the world. But somebody's paying for it. So there's a misconception if your employer's paying for it. You don't really know what they're paying. You think, well, I've got health insurance. It's brilliant. But the individual's interpretation of brilliant might be different from the infrastructure. They might think it's brilliant because I can see the doctor quickly. But that doesn't necessarily mean a good thing, because then the doctor's able to see you means they're quiet, means they might need to make money. So I'm not being cynical. That's what this is about, is being open. How does it work?
What's like the price difference? Say, for example, I'm a solo entrepreneur in Dubai. What cost, as in like a standard price you can expect per year or monthly compared to the UK solo entrepreneur?
I think it's a huge difference in terms of from the minimum you can pay right up to the top level.
So what's the average here? Like, what's just a normal standard average?
It will, the huge variables again, depending on age. So if I pick the average, let's say age 40 as the average in the age group from 20 to 40 to 60, then you're looking at, let's say, and again, it depends on what level of cover, but I'm trying to give an answer, 10,000 dirhams.
Yeah, that's a year.
Per year.
So 2,500 US dollars.
As an average.
That's in the, say in UAE. And when you compare it to the UK, if you're like an entrepreneur, how much would you think you pay?
Very different model, because the entrepreneur will be within the National Health Service, and it's very difficult to get. I do quite a lot of Google searching or whichever search engine you use. It's somewhere in the region of 8 to 10% of earnings is spent on the National Health Service. We're going up in cost all the time, but we're not in that level of contribution of a percentage of people's earnings. So although people's perception is the NHS is brilliant, it's free, it's not. Right? It's a funded model differently to what we do here. So costs here over the nearly 20 years have dramatically increased, much more than country inflation. And people don't really understand that. And that's in a simplified answer because there's misuse, there's fraud, there's overuse, and there's doctors' salaries keep going up more than inflation as well. So there's quite a lot of factors. So people will think, well, I'm taking out my policy for 10,000 dirhams. I'm expecting to pay 10 next year. And this is a very important point, Chris. The average increase will be at least 10%.
But what would be the average cost then if you're, but he said it's 8 to 10% you pay from the salary you're earning?
No, that's the sort of UK cost, as it were. But here, employers don't really, the many employers I speak to, they don't budget for employees about, let's budget 5% of total package.
But on the UK, but what would you
UK different because it's already set up that it's funded by now.
Well, how much is the average?
8 to 10%, something like that.
But what's the 8 to 10% mean?
Of salary.
Of salary. So you're earning 5,000, say, in US dollar, for example, you pay 8 to 10% month.
You don't personally, but part of your national insurance and tax contributions is going towards the National Health Service that you don't see.
So if you're sole entrepreneur, you're earning, say, 10,000, you pay maybe 1,000 a month times 12.
Yes. Yeah, you don't know it. You don't know what it's going to.
Yeah.
So you don't get from the National Health, from the UK or the European governments around the world saying, here's your tax. This is exactly what is getting spent on.
Yeah.
Goes into this black hole, and we have to try and believe we're going to support the politicians.
So it's a lot more in the end. You can actually, like in other countries, or in Germany, for example, you have different coverages. If it's from the government or it's personally, and then it can be thousands a month as well, or maybe 200.
Yeah, if you think about it, Chris, here, so we're talking about the UAE, we don't really have the aged and the older population that the European and the rest of the world will have.
Yeah.
This is a young, vibrant community in terms of people. The expat community is still a huge percentage of the total population, and we don't have that aged population, which is where the cost of healthcare ramps up. So if you think just simplistically, we should be always lower than what a mature European place would be.
What's like an average cost for a family, like 2 kids?
Again, if we take an average that we got to do before, 10,000 times 2 parents is 20,000. Kids, let's say, take them at 5,000.
So 30,000.
30,000 dirham. Yeah. And what we also really need to be aware of, Chris, is unlike the National Health Services, if you have such a health system, it doesn't assess you before you go in. If you're unhealthy, you maybe have diabetes, hypertension, you've had cancer, you're still in the system. You're not paying any more because of your current health status. Here, crucial point is people coming here, they're maybe thinking, well, healthcare, I've heard Steve talking, it's 10% of what we're going to earn. We'll budget for that. They really desperately need to take into account their current state of health, because that's going to change. unless they join a company scheme. And then even that's difficult to follow because they need to join a company scheme that doesn't underwrite them, as in ask medical questions. So as a general rule, let's say over 150 employees in a scheme will not be asking specific health questions. But smaller ones, and there are a lot of small companies here, 5, 10 employees, most of them will be asking each member fill in an individual health questionnaire. And if you have Crohn's disease, not uncommon. If you have diabetes, not uncommon. They will be affecting the insurer's premium. And most employers do not know this until they go through that experience. So it's a very different environment for healthcare than where you've got a national health service. Very different.
And is it also international coverage? If you have the insurance here, is it mandatory or is it extra, Europe, America?
Now, the only mandatory is you covering the emirate that you're in. So even to an extent, let's say we take Dubai, you need to cover the Dubai emirate. But it's evolved, and most of the more basic ones typically cover the UAE because they know people might drive to Abu Dhabi or Ras Al Khaimah. So the minimum is typically your emirate where the insurance is mandatory. But more often than not, if you take a lot of the workers who might be in India and the subcontinent, they'll maybe extend that to cover home country because, again, they know a lot of people will be traveling.
And the one you mentioned for 10,000, is that just UAE or is also Europe?
That's more like an average. I'm trying to give you an average that it would be Middle East and maybe a regional policy. There's not a lot of difference between, let's say, a regional and extending it to worldwide.
Yeah.
Because what happens, Chris, again, a good point is people might think on paper, so they might have a
coverage, but it's not.
They might cover, they'll go to maybe just on Google and get a search engine and just do it because they think they'll buy it on price and they see that it's even saying worldwide cover.
Yeah.
What they don't realize is, let's say they go to America and they think, well, my insurance says I've got worldwide cover.
Yeah.
It's based on nearly always with the local insurance market to what you would have paid here for the same treatment. And it's a terminology called usual and customary. So on paper, you'll often see maybe 80% of what's usual and customary. And it's written as UCR, usual customary rates. And people don't know the devil in the detail. And what that means is they see the figure 80%. The acronyms that are used, very few people dig deep and wonder what that is. And they only know when they start coming.
So you're not really covered.
It's like it could easily be 40% of what you paid. If you're going to America, it could even be 10%.
So you have something, an operation or something issue, you will pay from your own pocket.
You'll end up paying without realizing.
But how can you cover that then?
So that's either taking out a more comprehensive, more expensive policy to start with.
Yeah.
So that 10,000 average, you might end up paying 20,000, but it covers those pitfalls.
Well, how do you know if you say, for example, you just go into insurance market and you just believe another broker and you have to, how can you find out? You have to go into the small written things.
Yeah. You either find out by it happening and you go, I wish I'd researched it, or you research it first. And that's through, as I mentioned at the start of this, Chris, I learn every day. Different examples are in here somewhere, right, of what actually happens.
Yeah.
So on paper is a very different reality to experience. And you use that cliche, you can't buy experience. So I think because healthcare, it's more important than life cover. You either die or you're alive with life cover, right? It's too late, but on health cover, you don't really know what you're getting into until you've gone through a journey. Because on paper, very, very different. And I think if you're in a company scheme, that's kind of forced on you or it's part of it. You're not in the decision process. So I think we've got two different decisions. The people that are coming here to join a company, it is what it is, right? They might take up a top-up policy because their employer might not provide a good policy. Or if they're coming across as an entrepreneur, business themselves, then that's where they really need to get advice, I think. Or they buy it on what they think they're buying and learn the hard way.
Yeah, it's difficult with so you think if you have someone coming here and needs the insurance, what's the difference of going, say, on the insurance portals, like Insurance Market, or going with you? Do they get, of course, more expertise? Do they pay more usually compared?
No,
because it's like they probably most of them think if they go with you, they will pay more compared to an online portal, and maybe it's much quicker.
It would certainly be quicker because, as I said to you before we were setting up today, I look at it and go, I spend half an hour as back to averages. I'm easily spending half an hour. Now, there's only so many half an hours in a week that I have. There's only a limit to what I can do, but I do work probably too much in terms of helping people. And I believe in reciprocity. You give it out and you get it back. Most of my business is now, for what I'm doing, recommendations. And there's not an extra cost. It really is down to, I spend some time with people, find out what they're looking for, because there's definitely different areas of what level and quality of cover they can take. And if to put what we've even talked about now in an email, it's too much. It really is too much. So I do think the verbal spoken word is more powerful than just reading a price on a search engine. Nothing wrong with search engines. They're fancy, they're brilliant, they're more efficient in terms of people to go, right, I like the look of that. I think it's different buying something on Amazon than something on health cover, as the devil is massively in the detail. And if you, for example, Chris, go for let's say a more average premium, and you don't go for a more international one, which is when you're bringing all these claims in a community. So if you go for an average and you go for the 10,000 dirham one, and what health insurance should be about is the unknown, not the known conditions you've got. That's the definition of insurance. If it's already known, you're not insuring it. That's the strange thing of what we've got here. So if you do contract a cancer, something major, and statistics in the world, the percentage is going up all the time. If you have a more, when I say local policy where they're not in a community, you're individually underwritten. This is not for the company schemes, Chris. This is for the people coming across to set up their own business. You're in a claims-rated scheme, and if you have cancer, let's take Dubai, the insurer is allowed to increase the premium up to 100% at the renewal. Your 10,000, if you have cancer, would become 20. The following year, if you're still here, would become 40.
Wow.
They become 80. And the other important point that even as you're probably thinking, I'm assuming here, is that cost. But what you also need to be aware of is you're then pretty much uninsurable to get out of that trap.
Yeah.
Right? You either have to maybe change career and actually financially join a company scheme big enough that they won't know you've got cancer. Right? So you totally change your lifestyle, or you have to leave here, or you pay the cost increase. So that's what I mean about the devil's in the detail. There's a lot to it, and I'm not trying to complicate it, Chris. I'm really bringing it back to, I think you need advice. And as I say, I learn every day.
Yeah, what are the top 3 tips for expats for the families when it comes to picking the right insurance policy coming here?
I was going to say coming here. Yeah, first of all, look at it before you come here. Take away your perception of, I'm going to budget 10% of that. Take into account what your health is at the moment, and then research it before you come.
And if you come here as a tourist, can you get insurance as well? Or how do they get like a UE insurance?
Yeah, you've got to have, whether it's still police, Chris, or not, you're meant to have travel insurance as a minimum when you come here. It should be getting checked at the airport, right? And that's what's meant to happen. I've heard anecdotal evidence it doesn't always get checked.
Yeah.
So there was certainly a rule brought in that you're meant to have travel insurance before you come, for the purpose that you could come here, have a heart attack. This is a beautiful country, but they're not here as a charity. As we said earlier, fantastic if we are earning money, we're fit and healthy. If it's not, we don't have that infrastructure, and people need to be aware.
Do you think it's good when you look at other countries, what's happening around the world?
I think I'd summarize that, Chris, is people keep coming here.
Still coming here, aren't they?
Still coming here. You just need to be aware that, beautiful, sunny, very hot at times, fantastic when things are going well, but when it doesn't, there's not the infrastructure that many people's home countries would have.
Do you think it's good? Like for your side too?
I'm still here.
You're still here?
I'm still here. I think it's...
So if something happens, or if you have to lose a job or any health, or you don't know, would you then say, okay, I have to go back to a home country because there I can get all these benefits and things like this?
That's what happens. People end up having to go back to their home country. And again, it's not a nice subject to think about, but people don't always check, can they get back into their home country's healthcare system, infrastructure? And again, I don't want to say it as gospel, but anecdotal evidence, it's going to probably become harder to get into these countries because the strain that they're all under. So I think you've got to look at it and go, you've got to plan what actually happens if you stay here? More people are thinking that. What happens if you go back to your own country? And I think there's a huge, huge gap in the market about medical insurance for retirees. I get questioned quite a lot about, if we take that average of 10,000 dirhams, if somebody really wants an international insurer, they could easily pay 40,000 dirhams, and people are having to leave here because of the cost of healthcare in insurance. So that's something that I do hope that the government will develop. I believe they will. They build it and they will come as the mentality here. So I think that will be looked at as the growing, aging population continues here, because they do want people to live here and spend money. It's a clever country.
Is there any age restrictions of, say, moving here or getting insurance? If you like, say, 65, 70?
No age no restrictions. There are people bringing parents over here and again finding out the cost of healthcare after the event. And as I'm sitting here, I think of a lovely Scottish couple who brought their parents over here. Their father of the wife had some heart issue. They were trying to get health insurance for it. It was easy at that point. It was $40,000. And they're like, we need to scale down the network, what hospitals they can go to. And then he had an incident and they realized he can't stay here.
So he can't stay. So he ended up,
the whole vision of moving here with parents lasted about a year. So because of the cost of healthcare and insurance.
So so in the end, I have my parents, they are in Germany. My father, he's retired now since a couple of years, but he also has some issues. So he wouldn't also move to another country or go somewhere, because he has this hospital system and he can just go to the hospital every 2-3 days for something and to get checkups. So we think that would not happen here. You don't help.
It's not here to the extent as well as and not the infrastructure. I actually don't know of any nursing home here. The Nationals concept is much more of families, larger families, and looking after parents and bringing the parents in.
But don't you think the quality of the hospitals is very good, and the doctors? Because even my dad now in Germany, he went in hospital and he had to go back in hospital, and they then found out they didn't even check him properly. He had broken ribs, broken arm, and then the doctor said, didn't say anything then. Why didn't they see before?
That was in Germany, Chris.
Just now in the end,
Yeah.
So then he was shocked the first time he said, was shocked of the German hospital system doctors. He never had that experience.
Which used to be
renowned. Exactly. Yeah. But it's changed as well. That's why I'm saying, when you hear people, I talked to like a few people from moving here, and they said, well, the system is pretty good from the doctors. So what's your feedback on this?
I think it's very much anecdotal evidence. I mean, the amount of people that say a particular hospital is, I want that in the network. I've heard it's good. So they're buying, and they're taking situations where just because somebody told them, it's a human brain. The reality isn't from speaking to doctors. So I'm not medically qualified. I just speak to a lot of...
You believe, you have to believe, huh?
You have to believe that white coat syndrome, but there are definitely hospitals and clinics with good, trusted doctors that follow guidelines. And there are, as in any business, any field, there are the rogue ones that follow the money. And when you've got an insurance model where some of these doctors are paid on revenue share of what they bring in, human nature might be that might affect what they suggest for their patients, without going too in depth into that. So you've got to find, I certainly always tell people, my view is find a general practitioner or a GP that you can trust. And also there are quite a lot of models for insurance, be that individual or in company schemes, that can provide telehealth or video health, where people can phone either on the mobile, on desktop or whatever, or a mobile or a phone, and speak to doctors that are available, all the time, 24/7, that are not normally targeted to get more out of you. And statistically, about 80% of those outpatient visits, and I'll explain that in a second because people don't know the difference, can be dealt with over the phone. You actually don't need to see a doctor. It's evolved over the last about 15 years where even over the phone they can prescribe medication to you now, and it is the UAE, they can even get that delivered to your home or work. So there's a convenience, and there's also more of a view of, well, they're not trying to get extra out of you. So outpatient is where you're not using a bed, BED, right? And about 70% of what I see of claims are outpatient visits. The rest of it is daycare or inpatient using a bed. So that telehealth won't deal with that.
Mm. Are there any special insurance plans for newborns or babies?
No, not specially for them. Then, that you do, what comes to mind there is when somebody's born with something, it's called congenital. And again, people don't, quite often premature babies are born with a congenital condition. I have one just last week where twins were born and both boys, and they had a congenital condition. So often with most, not all, but most insurance policies, congenital's not covered. So that in itself creates an issue. They have to find a policy. So there's nothing specific, but most policies out here will cover the baby for 30 days once born on the mother's policy. And then you have to find a policy. Never used to be like that. The market's evolved. And then some employers will cover family as well. Quite often it would be husband, wife, and maybe 3 kids. But I think increasingly my evidence is it's become so expensive in Dubai. A lot of employers just cover the employee and the spouse if they're not working, has to find their own insurance, and so do the kids. There's a lot of different permutations that can happen.
What are the most questions, interesting questions which your clients ask in the beginning when they consult with you?
I think it will depend whether they're a company buying it on behalf of their members or if it's an individual. Company schemes is, what do I get covered for? I want these hospitals in place. And what does it cost? Those are the 3 typical questions. And they nearly always base it on what they're paying at the moment. Very few companies come to me and say, excuse me, I'm paying $500,000. I'd like to spend $750,000. What can I get? It's typically, I'm paying $500,000. Can you get me better cover for less money? That's a different conversation. For families, it will be, yes, definitely, how much does it cost? And what are the options? And then there are far more options to discuss, from the low basic cost, which could be as low for a blue-collar worker, let's call it 600 dirhams, that's as low as you can get, right, up to the 10,000 average. If you're 60-year-old, it could easily be 40,000 dirhams you're paying there. So huge differences. Hence why a conversation with an individual or family can actually get a little bit more longer term than a company one to start with.
I'm moving from abroad and I already have an international insurance. Do I still need insurance here in the UAE? I'm becoming a resident.
On holiday, that would probably cover. You need to check that. If you're coming here to move to live, then you need to have a compliant or a principal policy that satisfies getting your visa in the UAE. Okay, so the international one would have to be allowed to be continued here and approved by the regulators.
Okay, even if you have to get the residency.
So you'll find people that maybe have a BUPA policy from the UK. It might geographically say it covers them worldwide or worldwide excluding the USA, but it's not necessarily one that's approved and priced to be here.
Okay. Going back to this question again, if someone wants to compare insurance plans, use a broker, agent, or research on the internet, what do you recommend? As I mentioned before, you said the price is the same, because that's always the question a lot of people ask. Even what we're doing in the consultancy and the business setup, because we advise clients to you, of course, and also to the insurance platforms.
I think I'd start off with the word trust.
Yeah.
The buyer, the purchaser has to feel comfortable and trust the advice they're getting. So, if you're looking at how much they're going to cost, there's huge differences. So I think there's no harm at all. Saves me a bit of time to do some research, get an idea of the difference in premiums, try and figure out in your own head the difference in the cover and what does each line mean, and then get the advice. But if you trust what somebody like myself, there are a lot of good brokers out there that they're saying to you, and you think, well, listen, you know what you're talking about, I'm going to have to trust you because it's not my subject, is the person thinking, fine. I would, when I'm asked, as I do get asked, what should I take out? What's it going to cost? What are they? People go for averages, right? I would say, well, number one, the more expensive ones would typically be international insurers like Allianz, Hanse Merkur, your German company, Bupa, Cigna.
Yeah.
And then that's roughly speaking, it can be 50 to 100% of the cost of the second option.
Yeah.
The second option would be more, I'm not going to confuse it too much, let's just call it more local insurer, where on the paper, better premium, but you've got to know the devil in the detail. Nothing wrong with it.
Mm.
It's just a different something product that you're buying. And then you've got, if I just drop right down, you've got the real low cost or, whatever. You can have another level. And then you could maybe look at a real low basic and some sort of supplemental top up, depending what Emirates. So there's 4, possibly even 5 different like pigeonhole options that you can take. And each one is different in price and coverage. And what people don't know here when they're coming here, they plan coming here if they even plan that and get advice. What they should be doing is also planning. They might not know how long they're here. Most people come here for that 1 or 2 years and see how it goes. That's what I said. I'm still here. But what happens when you leave? And almost all, sorry guys, we're in a building 39th floor and there's a lot I'm looking at out here. You maybe can't see it. So I keep pointing out there. There's a lot of people, almost everybody will not think what they do for their medical insurance, which is our subject today, when they leave or when they retire. So virtually all employer schemes do not have any option to continue cover. And if you've got some ongoing illness, let's take an easy one, hypertension, and you then decide, I like it here, I'm going to retire, you're going to be charged extra for your hypertension. And on that, the amount of people I speak to and say, do you have any ongoing conditions? And they'll typically say for hypertension or high blood pressure, I've got hypertension, but it's okay, it's controlled, I've got pills for that. That's suppressing the problem. It's not solving the problem. So it's not okay. So insurers take the view, we're going to make some more money out of you. And they could easily charge 25 or 50% of your premium higher just because of that. And people don't know that until they get there.
What happens then? Like if
and really in that situation, so let's say you've got that 60-year-old person, the option is, or 55-year-old, whatever the age is, the option, you've either got to pay the price, continue finding a way to work in a company scheme that doesn't charge you that. So you might be thinking you're going to retire, but financially, it might make you realize, well, maybe I can't afford to. I might leave here. So that's why I'm really emphasizing, it's not just planning when you come here. When you come here, you need to start a plan of when you leave here, right? As long as we're physically able to leave here.
You think the number of retired people is quite high, over 60, 70, or do they really move back to the home country?
It's increasing in my evidence of people retiring here, but there are definite people that are having to leave because of the
people who have more money
because of the cost, right, of health cover, rent, whatever they're doing. They might own a property. So yeah, that's why I'm really emphasizing it, Chris. It's about be prepared, caveat emptor.
Well, for example, if you retire and you get your benefits from your home country, you could still live anywhere, couldn't you?
You can, but again, I'm used to the UK. You might have a national pension, right, a retirement pension.
I might get paid,
but it doesn't get index linked. So again, the reason why I can sort of explain the financial side is I used to be a financial planner. And most financial planners here, there are a lot of excellent ones here, but they don't really get into the health insurance problem. They'll basically, if they even ask the question, do you have health insurance? And it's a tick, right? They don't go into, what does that mean? What have you got? So there's not really a connect with a lot of the financial planners or health experts. And that's why I'm quite passionate about that, explaining. I certainly am aware of that British social club where there's a top up where people can use that. In the UAE, they can never use it as the principal policy because you still need to have at least a basic compliant policy for your visa. But it could be that infrastructure and, solid process. You've got a real one for inpatient and daycare. And I think this market's going to evolve and have more potentially of that because the current model is expensive for people that have any health issues when they retire. So I do believe in the country. I do believe that they're always trying to change and improve. Look at the roads. We have a clogged bit of the road. They end up building a new one to solve it.
Yeah.
So I think they'll solve it, Chris. Not aware of it being solved yet, but, I think it will be as we evolve as a country here. We're privileged to be here. We're not forced to be here, quite the opposite.
That's the thing, yeah? We want to be here.
Yeah.
We want to stay here.
Yes, exactly.
That's the thing. Going back to the Brit Club, can you just give us some insights? What's happening? When is it going to come out? When is it going to launch? What's the benefit?
It's something that just, again, cropped up, and Brit Care is the name of the insurance policy. They could have called it Jock Care for all I care, Chris.
But only specialising in UK nationals.
So that one's just basically anyone that's British or has a UK passport or married to, rather. So if somebody's a husband and the wife is Japanese, then that's fine. Can also cover kids. And the kids, back to that about longer term plan. It's very inexpensive currently for kids. It could be a policy for life. because there's no upper age limit. You can leave here and then continue being a member of the British Social Club, and that then continues giving revenue here, and then move back to the UK, and it could then become your principal policy. It's only in the 2 years of being here that you have to be here for 2 years, and then you can move wherever you want, as long as it's not to, when I say North Korea, like a sanctioned country. Don't know many people moving there, Chris. So yeah, there's that sort of thing, and that's where I think this market might evolve.
And when is it going to go live?
Well, it's live now.
Sorry,
It
live.
started on, 1st of December last year.
So how does it work? Is it similar like to normal insurance which you offer, or what are really the benefits and the pricing?
I'm just a broker on it. Benefits and pricing are considerably lower than if you did it as an individual.
So the lower
end, yeah. The economies are doing it as a group scheme. Again, the devil's in the detail. If people start claiming a lot on it, the premium will go up because it's a pooled community scheme. So the price is typically quite a bit lower currently in the launch phase, but they'll still need to have a principal policy. And then we're back into, do they do the real cheap one, the 10,000 average? That's up to each individual.
What are the other benefits of choosing that one?
Portability, take it wherever you want. Very few, if any, offer that here.
You can go worldwide?
Yeah, worldwide at the moment. It's worldwide excluding the United States.
Okay,
So you go back to Germany, you could take it with you.
So that means what? Then I'm covered 100%?
Yeah, well, covered for inpatient and daycare.
That means?
And a little bit of outpatient. Meaning that if you break your arm, for example, that is not classed as daycare. You're typically in, put a plaster on, and then you're out.
So you have to insure yourself extra.
Yeah, if you take that policy and go to, let's take Germany or UK, and you've got a national health service, then you could think, well, I'll use the national health service for this, right, for a broken arm. But Brit care or German care or whatever people do in the future, then that can be for the inpatient, for the operations. So it could be a queue jumper, it could be the choice of doctor that you want in a private hospital that the National Health Service doesn't give you. So it gives you choices, it gives you speed of delivery. Yeah, you can get it done quickly. Whereas if you're in a National Health Service, you could be waiting for a year and longer.
Yeah,
the waiting lists. Yeah. And are the waiting lists going to come down? Every subsequent government goes, we're going to bring the waiting list down. So why are they high again? Yeah, they all talk.
Just talk, yeah?
It's just talk, and it really is. There's always waiting lists. And, I know that cancer care is regarded as much more important, but literally as I'm driving into today here, I was listening to a UK radio station, and they're saying there's a real pressure and strain on the UK cancer system. That's just this morning. So is it going to get better or worse? Yeah. So that's what our supplemental policy could do, that you've got that. If it gets worse, you've still got the protection there. So again, it's that, be prepared, be planned.
You think you're going to retire also here?
No. I mean, I've got a young son, in fact, he's
retire. What is he, 13? What means retire? He's never retire. You keep on working, doing something, enjoying life. If it retires, like, okay, you stop everything.
I honestly don't know. Don't know where I'm going. Depends on relationships, depends on my son. I like it here. I think I'll continue working here in some capacity as long as I've got my health, or at least I'm going to use that round figure, 10 years. After that, I don't know. I don't feel 27 as I am now. I'm joking. I feel still relatively active up here, and as long as that continues, then I think I'll continue for a while. And where else would I go?
Asia.
Businesses here. I've thought about Thailand. I quite like the weather, and the infrastructure there. I've got a really good friend that lives there, so possibly Thailand, maybe Cyprus. Honestly, don't know.
Do you go often to the doctors' hospitals here?
Sorry, what did you say? Go often. I'm only joking, because that's about the only reason I go. Is a blocked ear. It's fact is this year.
Okay, so you make an appointment, or you just go to the doctor or hospital? How does it work?
Because my blocked ear kind of happens like that, I just turn up at the particular King's College Hospital.
So you just walk in,
and nearly always can get seen.
How long are you there?
Honestly, because again, I know them and they're very helpful. I'm often half an hour maximum.
Yeah, but even if you don't know them, would you get seen quickly?
Depends on the hospital. Depends on the busyness of the doctors that you want to see. But most of them are pretty easy to get in. It's a different market to National Health Service.
Well,
and not only can you get in, you can go straight to specialists.
Yeah. I mean, you couldn't get that in the UK, could you? You'd wait months probably for no, a point where you couldn't just walk in, could you?
Although that's a positive and you're smiling, most people perceive that as to be a benefit, but that makes it ready available. So people go to the doctor. The frequency of visits is a lot higher than a National Health Service. So this gap that we've got, we're cheaper and lower cost at the moment.
But you pay,
I see that narrowing.
You pay a consultant fee? Or
You'll typically pay a consultant.
So how much? 150 dollars?
Depending on your policy, it will vary.
How much do you pay?
You don't actually get to see because you're in a direct settlement environment.
Okay.
Where you don't even show your card now. It's your Emirates ID if you show that, or it's a soft copy if you've remembered to get that of the medical card. Virtually no insurer gives you that physical card anymore since that lovely word COVID. It's all changed that it's soft copy or Emirates ID.
PDF in your
So
mobile phone.
you don't actually know what that consultation's costing.
But if you go there, don't you pay?
You might pay. Most will pay some sort of deductible.
Yeah, but you pay?
You might pay 50 dirhams. My particular one's 50 dirhams.
Which is yeah.
It's actually 20% in Dubai, up to 50 dirhams.
Yeah.
So I pay 50, so I know.
Well, you still have to pay. So why would you go always to Germany? You can just go for free if you're working for a company.
What's 50 dirhams to most people here? It's not a lot of money.
But for the average earners, it's a lot of money.
For the average, yeah, but their deductible typically will be lower. It's going to be more likely 20 dirhams, 25 dirhams.
But still,
yeah,
it's a lot.
But it's still not a lot. There's a study done in the UK where a deductible, which was what we're talking, should be between 1% and 2% to make you think, I could probably get a paracetamol myself, right? So literally, as you can see here, I cut my hand with a mug as I'm putting something in the bin, really deep. I just went like that and quickly went to the pharmacist, took it off and said, can you fix it? And yeah, he did a bandage. I never went to a doctor.
Yeah.
Whereas most people here would be driving or somebody driving you to the ambulance, to the hospital, to emergency. Yeah. Before you know it, you'll have spent on the insurance 1,500 dirhams. Yeah. A plaster's a lot cheaper. Right. So ease of use, convenience, the Dubai model and the UAE model is perceived to be brilliant, right? But that's paying a cost in some way. You don't see doctors for free. If you think your insurance is paying for it in a company,
paying for it.
Indirectly your employer's paying higher premiums because you're going not every minute of the day, but you're going every month. Whereas when you've got an environment, when you know you can only go there when it is an emergency, there's not the same strain on the healthcare facilities. So we've got a very different model, very different. And that's why I try and bang that drum of people using telehealth. But people just either forget they haven't downloaded the app or they think it's their right. I've got insurance, so I'm going to see my doctor again and again. So it's a very different model, Chris.
Interesting. Yeah, last question. Would you advise anyone to move to Dubai or take it also all the options to move to, or what makes Dubai so special?
I never thought I'd end up in Dubai. Started off looking at Japan and another extreme, Venezuela. And for me, Dubai was, I could speak Scottish. I struggle with English, so I could speak. So I think the language availability here, it's almost strange to find somebody here that doesn't speak English. So I think nationality comes into it. Yeah, I'd almost like English not to be the world language almost because it's the only one I speak. So like you've got German. Depends on the language you're speaking. But as long as you're healthy and as long as you've got money, then it's a really good place. But with the devil in the detail again, it's pretty hot in the summer. I actually quite like it. I mean, with legs like these, I want to wear shorts. I'm joking. But for many people, it's too hot.
Yeah.
So it really comes down to, do you like hot weather? And can you afford to be here? And if you can, I don't know what's not to like. There is no perfect place. But this is, all I can say is they build it and people come here. It hasn't stopped. And I remember being here in the first year of being here, and there was a good friend of mine, Guy, who's died just a few years ago. And he was here 17 years, and I thought, my God, I don't think I'll be here that long.
And 20 years.
People still come. So yeah, 20 years, 19 years ago, a lot of this wasn't here, but it still gets built and people are coming. I don't see that changing at the moment in the foreseeable next few years. World events can change that, but I think people are coming on their droves.
would you advise anyone to move to Dubai or any other country, or what makes it so special? As you also know here 20 years and you never imagine yourself being here so long. So what would you recommend anyone who's thinking to change their lives, to relocate to another country, to build business?
I think the jolt of making that decision to move is something that will happen to the person naturally or not, as the case may be. You know, the comfort of being where you are, be that, you know, there's a national health service or a job or whatever. But when you make that decision to move, it's, you know, it's not as big a world as it used to be in terms of easy to travel. But for me, it's into what are you looking for? Where can you speak English? I mean, as I say, I looked at Japan. I don't fancy my chances of learning Japanese easily. So I think it's down to each individual making that decision, whether they're married, they've got kids. It's a bigger decision if you've got kids and married as well than on your own. So I think it depends on that. And, you know, would I advise anyone to move? No, it'd be down to them. If they make the decision they want to move, then that's where it's down to where do you want to move. I wouldn't suggest to anyone that's comfort and happy. So life's about being happy, Chris, isn't it? If you're happy where you are, why would you change it? You know, so happiness is the biggest emotion that I think we all try and strive for. Although people talk about money and success, it really boils down to, are you happy? You know, it's
well, you don't know. You could, for example, you could move here. You think you're happy before, like, because you come here as a tourist because it's so beautiful. And of course, it is beautiful with the beaches and all this shopping malls and the luxury things and the convenience and the restaurants. And then you come here, but then you experience it's not actually the place I want to be. Okay, you never know. You have to always take a risk, and you can go back or you can go somewhere else. But what I know, if you leave the country and you want to experience something else, and then you do go back to your home country, it's very hard to leave again. Then you don't give it time as well. You know, you don't give it time to make the change in another place, and you go back into your comfort zone.
Yeah, I mean, I think Chris had really good friends of mine. They were here for almost the same time as I arrived. They went back to the UK, quite a quiet place. It was actually during COVID, and they lasted about 4 years. They just couldn't handle the difference of what they're used to here, and they've come back maybe about a year ago. That's just one example, but there will be people that leave and never come back. But you get to that stage of people here saying, I've had enough, I'm done with Dubai.
But why? What are the reasons, do you think?
Maybe too busy, you know, too much working involved all the time, or maybe it's the weather, they want to get some...
Depends on what work they have, if they're working for a company. Yeah. Well, it's not like they work more than in their home country. It's not like people don't work more. You think everyone works more. It's just the pace, and it's like non-stop, of course. Yeah? But it's not like a more work.
I think, I mean, we were again mentioning earlier when we had Eid after Ramadan. That was a magical. I love that. I
enjoyed that. I
really enjoy it.
But the first time, I can tell you also, first time I think in the last years, because I'm always a guy, I need to work. Everyone needs to work. No one can take rest. Everyone can take rest, but it's like, we don't need that. I said, we don't need these holidays and stuff. But the first time I said, I really was looking forward and I enjoyed it.
Yeah.
You know?
Yeah. Same. And not for
the moments, you know, the moments to appreciate really the time, because time goes so quick. Yeah. It's like we talk this, it's a pace.
Yeah.
But it's not like people work more compared to our own countries.
There's certainly I think people generally work maybe a little bit more to some countries like France or whatever. But overall, people will work here comparable to their own country.
And you can't just you can't just be ill in the end. You can be ill, but you can't just go to the doctors. In Germany, you have a yellow note, and you're ill a week, 2 weeks, 3 weeks, 4 weeks, 5 weeks, 6 weeks. You still get a salary, and you will keep your job, for example.
Yeah.
So that's the risk here.
I think there's exactly that. So we started this, or some point in this conversation, Chris, was as long as you're healthy and you've got money, great place. But there's pressures anywhere in life. I mentioned earlier about being happy. You think you're happy, and then another bump in the road comes, another bump. It's pretty hard life, you know, in that respect. You just got to do everything you can to try and get as many, you know, less bumps in the road than more, and do it that way.
Yeah, but if you look at, say, Scotland, you're from Scotland or UK, people use the system, don't they?
Yeah. I mean, so let's again take magical here. It's great. My son, whose birthday, hi Alex, is 13 today. He loves Scotland. He likes the greenery. He loves the fresh air. And it's too hot for him in summer. So back to that family infrastructure as well. I like it here. I mean, I like Scotland, but I don't particularly like the weather. whereas he's different. So the pressures of that, husband and wife, husband might like here, wife doesn't. So there's a lot of, divorces, separations that happen here when people come here as well. Back to that, husband and wife moves here, both really keen on it. One loves it, one doesn't. That puts strain. Either you move back because you're going with the spouse or whatever, and whatever happens there, you don't know what's going to occur until you're here for some time and go through the journey.
Exactly. You have to try. You have to try, yeah? You have to make, oh, look, sandstorm there. What's that?
Oh, yeah.
Or they're building some, the construction. That's the thing. Yeah, thanks, Steve. That was a great interview, giving some guidance on the health insurance insights of yourself personally and what the client, the expert should choose. In the end, go with you, for example, the health insurance, I think is very vital, which I've also learned more and more now, comparing to a broker and to an insurance market platform. Yeah, because the pricing is the same, but you're getting the information, like you're going to a developer or you're going to us as a real estate agency, because we'll have the overview of the whole market and we'll give you the total experience, instead of going to the developer, because he will only sell you his unit. Sure. And the same thing with you.
It's an analogy there. It's a good one. It's the advice part. You can't look at the internet and get advice. And ChatGPT, whatever these modern people are using, will give you something, but depends, garbage in, garbage out. I hope we still continue the human touch in the world going forward with all this.
I think so. It's we also use AI, and I use a lot of ChatGPT. Yeah, but I've also learned you need still the human. A lot of things can be replaced, but not everything, and it's not still need to keep it personally.
I think so. We're human. We need interaction. Yeah. So I think there's always a position, and hopefully that will continue for humans giving advice and opinions.
It's like if you have any issues, service banks or something, you try it with everything online, but somehow you still switch to some human.
Yeah. Even chats, the robot chats or chat.
It's not the same, is it?
Can I just speak to somebody, please?
Exactly. You just want to speak to someone because he will give you the right information.
Yeah. Even if you phone something in, your home country and there's a system for an hour you've got to wait, they'll tell you the average wait. I still feel comfortable spending that money on an hour's wait. I can do some work and I know I'm going to speak to a human being. I did that recently to do with national insurance. I just didn't want to do it on an email. That's me. Yeah. Everyone's different. Got to figure out what you want.
Thank you.
Pleasure. Thanks very much, Chris.